Hi, my name is Hannah. I am a RVT working at a very busy ER and specialty facility in Maryland. I am the one that you see in blue scrubs here that is currently walking my client to our exam room to take some history and some vitals. I have VetRec in my hand on an iPad, already recording. I've already asked for consent, and we have the whole process going with VetRec open just in case we get some history on the way back to the room. At our ER, we found the two things that took up the most time with our previous triage process before VetRec was we were writing everything down on a clipboard, history and vitals, and then having to put everything typed into the computer afterwards just took too long. So this saved us an average of 5 minutes doing everything through VetRec. We're able to just do the vitals through VetRec and get the history. Now I've switched over to a desktop because it's just easier to use. We have our triage template in front of us. We have the consent line at the top. We have vitals all listed out, and we have our history listed. I will proofread through the history. Generally, it will have occasional spelling mistakes, but for the most part, I don't have to change much. We have a current medication line next, and then we have prior medical history. And occasionally, if I need to change anything, add anything, I can just type it in directly in this box and then hit save for any of our changes. I do have to put in the level for our triage if I didn't say it out loud for the AI to pick up on, and put in my initials. Then I hit save on the right-hand side and copy to clipboard, and then we're ready to put it into SmartFlow. So now our triage tech will transfer everything over from VetRec into SmartFlow. Because we already have all of our vitals listed, it's easiest just to do this in a split screen method on a desktop where they can easily just look from VetRec and place it right into SmartFlow. And for the history portion, we have that little pink box where they can just copy and paste those triage notes right into it from VetRec. Our doctors use the VetRec app on their phones to dictate their exams out loud in the room, and the hardest part for them has just been learning how to dictate it out loud in a way that they're comfortable.
She is bright, alert, and responsive. Hi, Mama. Her
eyes are
clear. I know, sweet girl.
It says now.
Her gums are pink and moist. Capillary refill time of less than 2 seconds. Hi, Mama.
She did have a little bit of diarrhea in the triage room.
Her ears are clear. Sublumbar or submandibular lymph nodes palpate normally. Prescapular lymph nodes palpate normally. Why are you shaking? You're okay.
Picking up.
Good smile again. No murmurs or arrhythmias on auscultation. Femoral pulses are synchronous and adequate. Lungs are cleared bilaterally. Stand up for a moment. Oh, I know. Mildly tense on abdominal palpation. No masses or craniomegaly appreciated. Normal.
So then our doctor will go back to their desktop and search their patient on the left-hand side of the screen and review the whole case from case summary through consent line, through the history they got with the client, and through the physical exam. Ours is listed out like this in our triage templates. And then they'll go into initial diagnostics, diagnosis, treatment plan, and client comms. Some of the templates in VetRec will automatically have a diagnosis. We don't include that in ours. We like to type in our own, and we will go back and put in our own diagnostics. Then what we do is we copy the template once we've made any changes we need to, and we just paste it right into our EasyVet. And then we'll click add and show you what this looks like here, where the doctors don't do their exam in front of owners per se, and they're just doing it for like an overnight patient that's hospitalized. We have this type of template where our doctor can just put their phone down next to the patient while they're examining and just dictate out loud to VetRec. Without a doubt, the number one thing our doctors love about VetRec is that they can carry it with them and do their client comms so much quicker than having to memorize everything that they've said at the end of the day and sit there and put in their client comms based off of their memory. I also love it because as a technician helping them out, I don't have to physically be there to understand the plan for the patient and what's going on. I can just access it through VetRec. We have our own separate client communication template so that when the doctor has to do any type of client communication, they can just start a new patient record per se, or they can even add on the new recording to their previous record, depending on what the doctor wants. And another VetRec feature that our doctors find very helpful, especially in ER medicine, is to be able to drag and drop those RDVM records right into a records recap, and it will transcribe those records within minutes. It saves so much time just to be able to see it all listed out. On our template, we have the onset at the top, the recent diagnostics, the medical history, and the current medications. I would recommend making your template like on a timeline for whatever seems the most relevant. We have ours for only giving us a history back for the most recent month, but you can always adjust it per each template. We also, on the onset area, put in our template for it to list reason for transfer. Over the past month, at our hospital, we have had 1,900 visits with VetRec, with 18 users, and we have saved just shy of 317 hours of our time. That's our personal time outside of work catching up on records, and our time at work. We're able to see many more cases thanks to VetRec. Thank you for helping us with our patients and our own personal care.